England is ending all of its COVID restrictions today despite a rise in cases. Nightclubs opened for the first time in 18 months as people celebrated the end of the mask mandates and social distancing. But now Prime Minister Boris Johnson and some other cabinet members are in quarantine after the UK health minister tested positive. Senior foreign correspondent Ian Pannell joins me now for more on this. Good morning, Ian. What's the latest?
Yeah, good morning, Diane. That's right. Welcome to Freedom Day in England. That's what it's been nicknamed by the tabloids. What it means in practice is you no longer need to wear this in certain places. However, of course, private companies are allowed to enforce their own rules. So actually, there is a tube station, a metro station right behind me. If you go down there, you're still supposed to wear your mask. But it means that the restrictions on social distancing and capacity in restaurants, in bars, in theatres have now been removed. It means that workplaces no longer have to advise people to work from home if they can. But so far, look, people are voting with their feet, as you would expect. I still see caution in the air. Oxford Street in the centre of London, for example, this morning was pretty empty. The number of people walking by wearing masks is still probably around 25%. Opinion polls suggest that people are not convinced that this is the right time as infections rise. As you say, we're almost up to 50,000 cases a day. But now is not necessarily the right time to lift those restrictions. And meanwhile, just to show how infectious the Delta variant is, and we're talking about people who have been vaccinated, we see the health minister going down with testing positive with coronavirus, the prime minister having to isolate after some political controversy over the weekend. So, look, the picture is much better. I think key for us, listening to those earlier reports, is whether or not you've managed to break the link between infections and hospitalizations. We're already seeing people who've been fully vaccinated are definitely getting infected, and some of them are getting ill, but there is little evidence to suggest any of them are getting significantly ill. And in terms of infections, they're almost back up at the original peak. This was in January. But in terms of hospitalizations, it is significantly low. I was hearing Steve Osanami there talk about 40% rise in hospitalizations. We're seeing nothing like that here in the UK. Just finally, just leave you with the figures that we've got here. We've got almost approaching 90% of all adults in England, Scotland, Wales and Northern Ireland having had one jab, and approaching 70% are now fully vaccinated with two jabs. That's one of the highest in the world, and that's why we hope, we think, we believe that that link between infection and hospitalizations has been broken. Diane?
And Ian, it sounds like that's the key, that 68%, as you said, of adults there fully vaccinated, many more with at least one vaccine. So, and it sounds like that's what's allowing the UK to make this decision to lift restrictions despite the rising cases there, because as you said, you're not seeing the link between that and rising hospitalizations. So are there lessons from the UK vaccine rollout that can be implemented in other countries? Can other countries watching learn lessons here?
I mean, unfortunately, the very simple and easy lesson is if you can get a jab, get a jab, because the risks of not doing so are so great. And it's the Delta variant that's been dominant here for a while. I think, actually, if you look at the various peaks and troughs throughout the pandemic, the UK and the US have had roughly about 4 or 5 weeks between them. And so we're seeing an exponential rise in infections here. But what we're not seeing, as I say, are those increased hospitalizations and deaths. Deaths at the moment are still low. Now, of course, it's early, but actually, if you look at the escalation of the graph in terms of infections right now, compared to hospitalizations, it's kind of very unscientifically, it kind of looks like that. Whereas if you look at all the other waves, they tended to mirror each other. So it started off much lower, but gradually the hospitalizations and the deaths started to escalate and ultimately overtake infections. So getting the jab, still probably wearing this in certain situations. I feel the country's changed. I think a lot of people are just cautious. Yes, nightclubs opened. Of course, young people are going out there mixing. They've made a lot of sacrifices to protect the rest of us. And I think there has to be some expectation that you're going to have to live with a certain amount of infection. I think that's the lesson we're coming down to. If it doesn't endanger the health service, if people aren't dying, then you have to live with that level of infections, and most people are showing flu-like symptoms, nothing more serious. Diane?
All right, Ian Pannell in London. We appreciate it, Ian. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.